Hello, very good evening to all of you. Today, we are back with another letter after a couple of weeks. This is a long letter, and it appears to be a bit complicated because it has a lot of information, a bulk information here. So, for many of the candidates, it seems to be very hard for them to solve this. So that's the reason why I've selected this particular question. The question is a referral letter of Mr. James Seymour, who insists referral to a rheumatologist. And we are writing to a rheumatologist whose name is Dr. Malcolm Still at 5 Grand Street, Fairmount. And the reason why we are writing is to request for the treatment or investigations for Mr. James Seymour, who is currently a patient. So, Mr. James Seymour has a provisional diagnosis as gout on his left toe, first toe. Other information, let's see in the question. Here. Mr. James Seymour is a 60-year-old man presenting in your general practice with a swollen left large toe. This is a letter which is supposed to be written by doctors because it's a medicine letter, but we are taking it as a nurse letter. So we are writing as a nurse here. So actually the original question is for medicine, OET medicine. So we are practicing it as a nursing question here. So the name of the patient is James Seymour, and he's 60. His date of birth is given very clearly there. So we don't have to go with the social history except his drinking habit, because a gout patient, if he drinks heavily, this will be increasing the risk of gout. So lifestyle modification is necessary. You need to reduce his amount of alcohol consumption considerably so that his gout symptoms should subside. So drinking, except drinking, nothing is relevant there. Now we have observations, all are normal here. Allergies, nil, none here. The past medical history, no, the family history, we have something very important here. His father died at the age of 75, and he had a rheumatoid arthritis. I think he had his history of rheumatoid arthritis. Other family history are not relevant there. Now, regarding the patient's past medical history, we have the last thing important here, that's regular episodes of inflammation. Query gout first toe. Since 2010 consulted several doctors. Now it is 2014, I think so, around 14 years he has been consulting doctors for the treatment of this inflammation in the first toe of his left leg. So this is something which is relevant. Now the medications, it is important here, but we have these medications modified later because the patient was not taking it regularly. So again, we can look at these medications. The first medicine length out, second is indocid, and third is allopurinol. All these medicines are going right now. So these medicines should be read, even if we don't write how many tablets and the dosage and the frequency. We should mention these medications are going for the patient because we are writing to a rheumatologist. So this becomes very important there. Now, the treatment record. So he presented to you on 25th of April And what was the condition? It was on his 4th week into current bout of gout. So you found we are not going to write everything in detail. So we need to concise it. We need to brief it. So we have to say something important there, that the medicines were not taken appropriately. So it was taken erratically. And he was not taking allopurinol for a couple of months too. So even though he tells that he modified his diet with reduced purines, what we have to consider here is that when he came, he was into the 4th week of current bout of gout, and the medicines were not taken properly. Now, these are important. Now we have to see that we on examination we confirm that the poor compliance with gout management. So what is the treatment you have given is that we resume the full dose of colchicine, which we are going before, and indomethacin, which were going before. Now we have given an instruction to stop it if side effects like diarrhea or GI upset occurs with these medicines. So regular medicine, paracetamol, it's for 3 days. So that will be over because it was on last month. Now it's on May. So we are not going to write that because paracetamol is not going now. Now, take oxycodone. If sore, can't sleep, try to cease as soon as possible. So it is not going right now. So we are not going to write it. Improve dietary compliance and alcohol intake. So we have to write it because it's something which is related as a treatment, which is regarded as a treatment for the gout. Now we have seen the patient today, that's on 3rd of May, and you can see that there are minor degenerative changes on his left first metatarsophalangeal joint. So this is something very important here. We need to inform to the rheumatologist, and we have say that the other two urate and FB, all these things are not normal except the CRP level, which is double of the reference range. So we have to mention that the CRP level, the C-reactive protein is higher. It's because of inflammation. Now, the gout episode is subsiding because the episode is going to be cured now. So the bout is subsiding. Now, only needed nighttime oxycodone, only needed nighttime 3 nights. So it's not relevant right now. So what we have to go with the medicines which are mentioned, 3 important medicines which were given earlier. So we need to say that. And now we have to say that provisional diagnosis is gout. Discuss synovial fluid sample stat next episode. So that comes later. So we are not going, if you are informing the dermatologist, it's okay. If you are not informing, that's also okay, because it has not yet done. We just have a discussion whether to have synovial fluid sample stat next episode. So right now we don't have the records of this thing. We have not sent this thing. We have no results of this thing. So that is nothing important to the rheumatologist right now, because we don't have any relevant records. We don't have any such things there. Now we have started allopurinol and long term and reinforce messages regarding diet and alcohol. So that's very important. And the dermatologist. So one thing that you have to be very careful with this thing is that we have a bulk of data here, and all these things are not needed. We have to select things appropriately, organize things in correct positions. So this is a challenging situation for many of the candidates here. And we have the date 3rd May 2014. Yes, that's it. Okay, Dr. Malcolm Still, rheumatologist, 5 Grand Street, Fairmount. Dear Dr. Still, reference Mr. James Seymour. Date of birth we have written instead of the age, that's 60. Date of birth has more clarity. That's why we have written the date of birth. Now we have something important here in the purpose. This letter is written on behalf of Mr. James Seymour, who insists a referral letter to exclude him of rheumatoid arthritis. Now, this is a referral letter. We are not going to refer the letter by our own, just because of the insistence of James Seymour. James Seymour has told us asked us for the reference. So that's the reason why we have written like this, who insists a referral letter to exclude him of rheumatoid arthritis. So this is not a direct letter. This is a request. This letter is being written as per the request of Mr. James Seymour. Okay, so this letter is being written as per the request of Mr. James Seymour, who insists a referral to exclude him of rheumatoid arthritis. This is the highlight there. And he requires further investigations and treatment. What is a requirement? What is a request? So he requires further investigations and treatment since he is provisionally diagnosed with gout on his first left toe. That's it. We have completed the patient name, the real reason, and it is for the insistence of the patient and what he requires, that is for the investigations and treatment. So everything is there just in 2 sentences. Now let's go ahead to the first paragraph. Mr. Seymour, who has a family history of rheumatoid arthritis, has been consulting different doctors for his suspected gout symptoms since 2010. Now, why we have written his suspected gout symptoms is that an inflammation in the toe. So we have not directly writing it. So we have written suspected gout symptoms instead of inflammation. So indirectly we have said that gout symptoms there. Okay. Now, since when? Since 2010. So he has been consulting different doctors, and he came to our facility too recently in 2014. So almost 14 years he has been consulting different doctors for the treatment of this gout. Suspected gouts, I mean. On his visit to our facility on 25th April, he was in his 4 weeks into the current bout of gout. So that's very clearly mentioned when he visited us first. This was his gout condition. It was observed that he was taking his gout medications erratically. So we have said that some medications were altered, some medications were stopped. So the gout medications, what was prescribed earlier, was taken erratically when at the time of admission when we consulted him. So this was the condition. Confirming symptoms consistent with gout, he was advised to resume. So upon our observation, we confirmed symptoms consistent with gout. He was advised to resume his full doses of colchicine, indomethacin, with instructions to withhold if side effects arise. We are not going to elaborate it. Side effects such as GI upset, all these things it becomes a lengthy letter. So even now we have reduced a lot number of words, still it goes around 200 words here. So this is really risky. If I cannot include all of the data here because the word count goes increasing and increasing and increasing. So what we have concluded in the first paragraph is the background information. He had the problem since he has had the problem since 2010, and he visited here on this date, and this was his fourth week. What we observed was he was not taking his medications properly. we confirm consistent symptoms consistent with gout, and what we have intervened is that we have started, we advise him to resume his full doses of this thing and this thing, with instructions of withholding it if side effects arise. Now let's go into the second part on his review today. That's on 3rd of May. Minor degenerative changes were observed on his X-ray on his first metatarsophalangeal joint. That is something different. It's not metacarpal. Metatarsophalangeal joint. Now, so this is something important which a rheumatologist should know, so that we have highlighted there. Although his gout episode was seen subsiding, yes, now today what we saw is his gout episode was seen subsiding. His CRP level was noted as high as 6.0 mg per liter. So it's advised to write C reactive protein instead of CRP. It's for your understanding, I have written the CRP there. Even a rheumatologist can understand what is CRP level. Candidates are really recommended to go with the full form, as the OET recommends full form instead of abbreviations. It was commenced on allopurinol on long-term basis and was re-educated regarding the importance of the appropriate diet and reducing alcohol intake. So we have not mentioned that he was taking excessive alcohol 5 years or something things, because the letter will be going the word count will be going high, and there will be repetitions everywhere. So that's the reason why we have written, because what we saw earlier that purine, he reduced purine in his diet. But finally, what is the current condition is that he was educated regarding this importance. That's when, if we don't write about the diet and alcohol, the letter becomes incomplete. That's the reason why we have mentioned it, because we need to say something, because he's an alcoholic. Instead of saying that how many units of alcohol he's taking, it's always better that advice is being given to reduce alcohol intake. So what is better? What we have done it. Now, what is our request? It would be appreciated if you could attend Mr. Seymour, who will visit you with a copy of his pathology results, help him in confirming his diagnosis, and treat him appropriately. So we use the punctuations very clearly to reduce the number of word counts. So that's what we have written, we have seen in the last paragraph. So that's the core of the letter. So if you have any further queries regarding Mr. Seymour's condition, please do not hesitate to contact me, or sincerely, because it's in our, we know the name of the doctor. So we have concluded, your sincerely registered nurse. Thank you, one and all. I hope you have understood this thing. So one thing is that we need to learn how to reduce the word count without losing the essence of the letter. Thank you. Meet you soon with another letter. Have a nice day.